Hi, everyone. Welcome to the Breast Cancer Podcast.
Yay.
And it's me, Deepa Halaharvi, and I'm with Monica Brooks.
Yes, we're here together. It's been a while since we were able to record a podcast.
Yeah.
Kind of took a little break there. So it's a nice time just to not interview anybody, but maybe just see how we're doing.
Yeah.
Why don't you go first? How are you?
Yeah, I'm doing great. Thank you. And I think it's always a good idea to take a break from the things that we do, like we're doing it monotonously as a robot, like you show up, you're doing it. But I think this was really good to take a break, to kind of reassess, to see where we are, how far we have come. And also, are we making a difference? Is this a worthwhile time for people? And Monica, I have to tell you, over the last month, I've had more people say how much this podcast has been helping them than ever before. So I took that as a sign that we need to keep, continuing what we are doing, because I think we are providing great education for people in the community.
Yeah.
And so that was my sign. How about you?
Well, what are you doing? Good. And I think that's great how you mentioned to stop and reassess, because I even asked myself, can I continue to do the podcast? Because it is a reminder of breast cancer. Sometimes it can be very triggering. And is this what I want to do? And I think taking that break in August for me was great. And I think sometimes I want to take a step back from the cancer community because it is so hard and you just kind of want to move on. But I don't know if there's really ever this move on versus move with. So move with my diagnosis for the rest of my life. And so August was a really hard month for me. When I talked to you on the phone, I remember I was just it was just, and you're take the time you need to get better, to take care of yourself. I just don't feel like my mental health was in a great spot.
Yeah.
And that comes and goes sometimes. So, but what I love, and after talking to you again, is knowing the impact that we have.
Yeah.
And if there was any part of breast cancer I want to stay connected to, it is through this podcast. I love the people we interview. I love talking with you, of course, but it also is a reminder for me how much this is helping people. Yeah. So it's been a crazy August, but I'm thankful to still be around here and record this video.
Yeah, you're in September now, right?
I know.
So
and
it's crazy.
Then October is the big month.
Correct.
And that's also my 4-year anniversary from when I was diagnosed.
Okay.
So
I did not know that.
Yeah, it's crazy to think about how far I've come, you've come, and even our relationship, I think too, has been pretty cool. But I thought what would be nice as well is let's just talk about survivorship. How long has it been since your diagnosis?
I was diagnosed in 2015, so it's been 7 years this years. Yeah, so I think it's really important as you talk about your anniversary, the feelings that come up is fear, because you were diagnosed 4 years ago in October, and all those emotions resurface up. And if you're around those people who are diagnosed with breast cancer, then you're sort of living the entire thing through them. And it's not good for you.
Yeah.
And so it's really important to make sure that you're very conscientious of those feelings, because don't ever go away. They do get better. The PTSD is a real thing.
Yeah.
And you have to be very careful about that. The scans some patients need to get can cause anxiety regarding scans. So that's something that you want to be careful and mindful about.
Yeah. And I think that's also a great point when we were talking about taking a break, because I think social media can be that blessing and curse, because it connects us to so many people and you really don't feel like you're alone. But then at what point do you take that step back and wow, this is really triggering because this person's cancer came back, or this person is stage 4, or this person passed away. It's hard, mentally and emotionally, that's a lot. And I would definitely recommend, if you're feeling that, take a step back from social media.
And I think what I think of October also changed because of COVID. And I have seen the impact of COVID on patients' mental health. And so mental health is really on my forefront. I mean, I've been burned out in my own practice. And just like you, I figured out a way to take a break. I mean, I can't take a break from work, but, just spending more time in solitude and, exercising and meditating and prayer and maybe watching TV or reading a book or, spending time with my family and friends. Those are the things that re-energize me. And I think it's really important to know that this whole cycle of feeling good and feeling bad and feeling depressed and feeling sad is just a cycle. It comes and goes.
Yeah.
We're never going to get to that point in our life and be like, okay, it's all perfect. Everything is great now. It's never going to be like that.
Similar to COVID, right?
Similar to COVID.
There's so many similarities between COVID and cancer. There's this line of what was life like before and what is life like afterward. And so it's knowing it will never be the same.
Yes.
So how do we move through our life, knowing that we've gone through this and been through this, and it's been very traumatizing.
It is very traumatizing. And I think it's important to be aware of that.
Yeah.
So let's dive into some survivorship issues,
Yeah.
shall we?
Yes.
So what would you say is the thing that bothers you the most as a result of your diagnosis in terms of symptoms?
I want to say the first thing, and it's honestly started to happen when my hair grew back, I thought was my cancer growing back as well. And I think it's that fear of recurrence, fear of so many different things, like every ache. But I have realized though, like the further I move out from all of that, like I have more awareness to be like, okay, my back hurts this morning. Like literally my back hurt this morning and I put a heating pad on it and I was fine. I didn't go to that place of fear, is this cancer? Because I know of all things I'm in control of, I'm in control of my thoughts. Like I control my thoughts and how I choose to think about things. And I don't want to create a space in my body for fear to creep in, because I know in my mind, thinking about fear is just a thought. My body doesn't know that it's just a thought. So I don't want it to experience anything related to fear or open any door for cancer to come back. So I'm just very thoughtful in what I choose to think about and the messages that I send to my body.
Yeah, I think that's really very, very important. And our mind is very powerful.
Mhm.
There's been a study that's looked at 10 different studies that looked at women who've been diagnosed with breast cancer and fear of recurrence. Really, the only thing that was common amongst all women who really surpassed this fear is mindfulness meditation. And so whether it is, being by yourself, spending time in nature or whatever it is that fills you back up. And I think it's really important to find out. And I think it changes as we get older too,
Yeah.
as to what things fill us up. But to know how powerful is your mind over your body. It's very powerful to know that.
Yeah. And I think that was part of my growth after the diagnosis, because I live more in the present now than I have ever in my life. So I know that every day I have a choice. Do I want to live in the past? Do I want to stay mad at somebody? Do I want to hold a grudge? Absolutely not. Am I going to worry about the future, which hasn't even existed yet? It only exists in my mind. So a lot of times when I start to feel anxiety and fear, I say, okay, where is this coming from? Is it coming from the past or is it coming from the future? And then I bring it back to the present moment, because I know and I have learned in this moment right here and now is where I'm going to find the most joy.
Yeah.
I can't change an outcome of something in the future. So why would I give it that attention? Like cancer has taken so much from us.
Right.
I feel like I'm not going to give it any more power over me. So it really does come back to how we decide to feed our mind and what we choose to think about.
Yeah, I've heard this before from a podcast or reading a book where then you're angry with someone or you're upset with someone, a situation that happened to you, and you're upset with this person. Well, that person is really going on with their life,
right?
Enjoying their life. It really is hurting you, holding on to that, anger and, that whatever situation that happened. I think it's letting go, forgiving, and maybe, I talk about surrounding yourself with people that empower you, that lift you up, and that give you joy. And you have to be very mindful. You talked about social media. Just because you're friends with, I have, how many, over 1,000 people on social media that are my friends, but are they truly my friends? Right. So you have to know who's your inner circle of people who will do anything for you in the middle of the night. You have to know who your close friends are, and then you have to know who your acquaintances are. And I think it's important to spend time with each one of them, but it's also important to know who your circle of people are and spend a lot of time with those people.
And you should walk away from those friends feeling energized and feeling refreshed versus feeling drained. And I think pay attention. That's one of the things I always do with myself when I'm with people is I will analyze, how do I feel? How did I feel after 10 minutes on social media even? Or how did I feel leaving dinner tonight with a group of friends? And if I feel good, then that's a good relationship I want to continue with. And if I don't, it's like, maybe I'll limit my time I spend with this person. So it definitely is who we choose to spend our time with and how much time we spend with them on social media as well.
Yeah. One of my mentors, Dr. Beth Dupree, she was on our podcast before. She calls them as energy vampires.
Yes. I've heard that term before.
Yes,
it's true.
It is true. It is very true. And it's important to know who your energy vampires are and just, make those boundaries around those people, because you really don't need to be taking that sort of energy for yourself.
Yeah. And I know it's interesting with survivorship because it really has been the hardest part, because you don't have the countdowns anymore from chemo, radiation, all of those things. And you're just kind of left like, well, now what do I do? And in no way do I compare this as if they're equal, but like when someone does come home from a war and they are left like, wow, I just fought,
Yeah.
you know, and
Yeah.
they come home and it's like, well, what do I do with my life now? Like I just went through something so traumatic.
Yeah.
And it's almost like so many of us have suffered from trauma. And it's like, well, who am I now? Now that I'm done with this, like I'm a warrior, I'm a fighter. Now what do I do with my life? And you just kind of carry on, and it's just, you're lost figuring out this new identity in a sense. And it's difficult in that way.
Yeah. And also our life changes too. I mean, you know, it's been 4 years for you from your cancer diagnosis. It's been 7.5 years for me. Lots has happened. You know, my son graduated from college. My daughter graduated from high school. And, you know, when those things happen too, you have all these big life changing events that happen to you, and you're still supposed to go on and carry on just like normal. Everything sort of adds up. And so it's important to kind of know how to deal with all these different life situations that do happen. You know, what is my purpose now? You know, what am I supposed to do? Am I just supposed to be a breast surgeon? Am I just supposed to go home and be a wife and that's it? And, you know, what am I supposed to do with this phase of my life? And I think every stage of life brings its own challenges and blessings. And I think it's very important to be mindful of that.
Yeah. And I think also with the blessings and challenges, it also brings a lot of learning.
Yeah.
And growth. Like I have learned so much because of my cancer diagnosis.
Yes.
I don't wish it upon anybody, but I feel like you can do two different things. One, you can choose to grow from it, or one, you can stay bitter. And I'll tell you, it feels so much better to grow from it. We all have a choice in how we want to look at this. And it took me time though. And I'll be honest. Okay. So you gave a presentation before and someone told me about it, and it talked about how you were thankful for your diagnosis. I was not in the right mental space to hear that. And I think you do have to be in the right mental space
to hear that.
To hear it and to know exactly what you're talking about. Because I remember hearing someone say, oh, it was like a blessing in disguise. And I'm like, how dare you? I didn't say that to her, but I thought like, I don't think we can be friends because it's hard. It's mentally hard, but you do have a choice to look through whatever lens you want to look through to see and to grow from this. So in so many ways, I'm thankful for the people that's brought into my life and how much I've grown. Like, I don't even think I would have quit my job. So I don't know if our audience knows this, but I had a position in leadership at a healthcare organization. I enjoyed what I did, but I knew that wasn't my passion anymore. So I don't think I would have quit a well-paying job if it hadn't been for my diagnosis, because it gave me a whole new lens on life. Like I knew I didn't belong there. I knew I was meant for more. And what am I doing now? I still have no idea, but I do know I just have to keep moving. I have to keep going. Similar to you. Okay, you're a breast surgeon. What do we do? How do we use this? But we just have to keep going and keep using our gifts however we can.
Yeah, absolutely. And I just got to give a talk to general surgery residents just last week. And I've shared my story so many times with so many people, and you would think, oh my gosh, it's the same story. What is there to share? But I think every time I share my story, I'm constantly learning something new. And what you talked about, finding meaning after cancer, is not always about making lemonade out of lemons, but it's a different meaning. And I think that meaning changes periodically for me.
Right.
Do you feel the same way?
I do. It's funny because I'm always like, this is kind of silly and not the same thing, but I'm always changing my bio on Instagram and LinkedIn, because I'm always evolving. I'm always changing, and I'm not one thing alone. I think that's sometimes a misperception we should have on life. Like, you can be a lot of amazing things without this title. There's no word for it, but it's like, we're always evolving. We're always changing. And I think we have to be open to that as well, versus feeling like you're stuck in a certain place.
Yeah. I have really felt like I've developed this power. It sounds very weird to say that. That power, invisible power that I gained as a result of my own struggles, not just with breast cancer, but the other struggles I've been through my life. And I think you do develop the muscle of resiliency, but also you have this confidence that, okay, I've faced all these things in my life. I can face anything and get through it. And I sort of try to tell my patients the same thing, because I see them at the worst time of their life. They're in this crisis of being told you have breast cancer, and I'm seeing them for the first time. And, you know, a lot depends on where we come from, our upbringing and background, and how we are trained to deal with adversities. And that's why I tell my patients, whenever they want to tell their kids about their diagnosis, once they have comprehended the fact that they have been diagnosed with breast cancer, I always tell them, tell your kids, like, you need to tell them to the level of their understanding. Keep it simple. You're going to get better, but mom is going to get through this. Because kids really want to know that you're going to be okay and alive.
Right.
They really don't care other things because they don't have enough knowledge yet to know what bad things can happen. But also this gives us an opportunity to help them grow and learn and show them how to handle adversities.
Yeah.
And I've also seen patients who handle their adversities and come out positive on the other end. They just go on to become, I can't even describe it, but this powerful person that you just look at them, and I have such a sense of joy and pride to see that person evolve from someone who was so scared and anxious and nervous to this person who is confident, and, you know, it really doesn't even matter what else is going to come their way, they're going to handle it.
Right. I think that's so true.
Yeah.
What are the different ways that you manage fear of recurrence and fear of breast cancer? Again, especially since you're in it, like deep with like your patients.
Yeah. So my first few years, I'll be honest, I thought about it all the time. Every time I had a back pain, every time I had a headache or cough that wouldn't go away. And the way that I deal with it myself, and I sometimes tell this to patients, but you have to be in a certain point in your life to kind of accept it and adopt it. And so this is how I look at it. So cancer is the enemy. So if I'm thinking about cancer recurrence, I'm just giving that much power to this enemy that I really don't want to give that power to.
Right.
I want to take the power back. So every time I have that fear, I go for a walk. I, do something fun for myself, or I plan a date with my friends, just my girlfriends, just to hang out with. For us girls, we really need to have friends that we can talk and someone to listen to us.
Right.
And I think the therapy, the free therapy that you get with your friends, exercising, spending time in nature, spending time with family and friends, and meditation and prayer. And I know as a result of my own diagnosis, I've been able to help patients, help other people. If it does come back, I know I can handle it. I can get through it. And if I don't get through it, it's okay, because I've been living so purposefully and such a great life that I have no regrets,
Yep, I totally agree. No regrets. I live with so much more gratitude.
Yes.
I choose to see the gratitude. Like, I choose to see joy every single day. I don't care if it's raining. I don't care if it's snowing. Like, there isn't anything that could possibly ruin my day when it comes to like the weather or an event that happened. I mean, bad things happen and I get that, but I choose. That's up to me onto how I want to live the rest of my life. There's another thing too, as far as fear, I think about is I don't watch anything scary.
Yeah.
I cannot feed my body fear.
Yeah.
Through any movie.
I'm the same way.
Yeah. Like there's violence. I cannot do it.
Yeah.
And I think I want to say I realized that when I was pregnant with my son back in
Yeah.
2015 and we were watching The Walking Dead and I was like, this can't be good for him. Like when he was in my belly, and that's kind of stuck with me. So I'm always very careful with what I feed myself mentally, even food wise. Like I'm more conscientious of what I put in my mouth, and exercising and helping reduce my risk of recurrence, even though we all know there's no guarantees because it's multifactorial, there's so many different things that could happen.
There's no guarantees. Yeah, it's very true. I think it's really, you have to be very purposeful in what things you put in your brain. And when everyone was watching Game of Thrones, my friends would say, hey, have you watched this episode or that? And I think I watched like one show or two shows where there was a small child who was killed in the show. And I just could not get myself to go back to that show. And I think it's important to know like what triggers you. And
exactly.
I think after you have kids, you do sort of become very sensitive to that kind of information.
Totally.
And also what you're talking about, Monica, about your mind being powerful is like what Viktor Frankl, Man's Search for Meaning. That's a book I always mention in my talks, how he chose his attitude when he was in the concentration camp. And I think we could have done that during COVID. We could do that with any crisis that's happening with us, because your attitude is really so important, because regardless of what bad things are happening, there's always some good things that are happening too. And I think focusing on gratitude, that's such a great message right there. So let's turn and talk about some survivorship issues. So have you had issues with hot flashes?
Oh my goodness. Yes. That has been, so I didn't realize from the onset that I would be going into menopause. And then I decided to have my ovaries taken out. Hot flashes have been very challenging.
Yeah.
And one of the ways, so can I just mention a few ways I managed that?
Yeah.
What about you first? Like hot flashes for you as well?
Yeah, hot flashes are now becoming a problem for me now. I'm still premenopausal, have my periods, but it seems like the hot flashes kind of get worse during my periods than, after my periods. The ways that I have been able to help myself, and they're only, I think, in initial stages right now, but I take magnesium twice a day. I try to dress in layers. I don't like spicy food, that can sometimes irritate and aggravate hot flashes. And make sure if there is a certain drink, like drinking red wine or hot liquids can, trigger your hot flashes, just be careful of that. And I tell my patients acupuncture has been so well studied for hot flashes. It works really, really well for hot flashes. And of course, there's medications that people can take and they need to talk to doctors like gabapentin or Neurontin. It seems to help. Effexor seems to help with hot flashes. Vitamin E and magnesium are both over the counter. They seem to help with hot flashes. So you have to figure out at what stage of hot flashes. Are you in the early stages? Are you getting up in the night and throwing your, covers off? I do have to have a fan on at night.
Yeah.
And so you just kind of have to know what things are happening to you so you can manage it based on that.
I think that's great. Paying attention.
Yes.
To what may be triggering them. Because I realized recently when I started paying attention was coffee. In the morning when I drink my cup, I'm guaranteed to have a hot flash. You didn't mention sticking your head in the freezer, but that is totally acceptable when you have a hot flash.
Yeah.
Sometimes I do that. Effexor, so definitely check with your doctor. We're not recommending Effexor, but Effexor has helped me manage my hot flashes. Sometimes I'm in the kitchen cooking. I will just run my wrists under cold water, like my hands up to my wrists, and that seems to help tremendously. Fans. I have a fan blowing right in my face, and then our ceiling fan. So I have 2 fans going at night. What I've tried to do as well is not to give it the attention when it's happening. I just be like, all right, let's just breathe through this, because mine, I don't know if anyone else experiences this, but mine starts as anxiety in my chest. So before I even get hot, I'll start to feel like a huge sense of anxiety, and then it swells into this big hot flash. So once I start to feel the anxiety, I'm like, all right, let's just do this. I don't want to pay too much attention to it. Because I feel like I'll get really worked up, because hot flashes have also made me very irritable and at times upset with cancer. Like I would get so tired of having hot flashes. I just wanted to escape being a cancer survivor, but that's not possible.
Yes.
So
this is our new normal right now.
Exactly. So, and I used to really, when people would say new normal, I'd be like, that word, but with COVID, it's the same thing. We're all trying to adjust to this new world. We've never been through this before.
Yeah.
And so it's the same thing with cancer. We have to just keep adjusting and keep going.
Yeah. Let's talk about chemo brain. Have you heard of the term chemo brain?
Have I heard of it? Yeah. Like I experience that all the time. Yeah. Like I think between chemo and menopause, my memory is awful, and my family has been so forgiving. Like they will not tell me if I'm repeating myself. Yeah. They just kind of, and I catch on to it later when they just kind of look at me and smile. And it has been very challenging. What about you? You didn't do chemo.
I did not get chemotherapy.
Talk about your patients
so I have a lot of patients who do suffer with the chemo brain, and it's as a result of the chemotherapy medications, and sometimes it's a temporary thing, sometimes it's a permanent thing. So it's really hard to know depending on what type of chemo medications that you've gotten. So things like trouble recalling names, trouble multitasking, unable to finish sentences, or doing a task taking much longer than normal. And not just that, the stress of going through the cancer diagnosis can also have a decline in the cognitive function. It's also seen in women who just take hormonal therapy. The endocrine therapy doesn't just have to be just chemotherapy. So what are some things that you can do? And so I tell my patients, and I do this myself, have a daily planner, write everything down for your day, and only do one thing at a time. We are not, I think as women, we want to multitask, but we're not supposed to be multitasking. It's not good for your brain. And I'm saying this, but I'm also, Are you
guilty of this?
I'm guilty of this myself, because your brain is not supposed to be doing so many things at one time. So you're supposed to be focusing on one task at a time. Keeping your clothes out the night before you go to bed, putting your keys the same place every time you put them, so you're not replacing or missing your keys. So you're
really talking to me right now.
I'm talking to myself too. I'm talking to myself too. And I've also realized my environment, whether it's my bedroom, my kitchen, my closet, I just need it to be clutter free. The clutter just irritates me and annoys me, and I think just kind of it mentally affects you.
Yeah,
it
totally.
drains you. It really does. So keeping things simple and clutter free, I think it's really important. And I have really moving, exercising is really, really useful. Meditating, exercise. I know I keep saying meditating, but it's really been studied for that. Healthy diet, making sure you have a routine, whether it's going to the gym every day. So my husband and I, we go to the gym every evening for like an hour. That's,
I don't know how you do that because I know you're busy. Like I know there's like nights for you.
There are so many nights I don't want to go. But I think it's nice to have sort of a buddy system where he's going. And so I make myself go. But once I start exercising, then I feel good. You know, it takes about 20 minutes. And I'm actually want to do a segment on this. I never ever feel motivated to go because we always think, should I wait for the motivation? That's never going to happen.
Right.
Yeah, it's not going to happen. You just do it.
Right.
You just like you get up and you brush your teeth, even if you don't feel like it, you just do it. So it's the same thing. There is some apps on your phone. A Sudoku is a really good one to get. Word puzzles are really good. And there are some games on your phone that you can get that helps with the cognitive function and your memory.
I was waiting for you to say Netflix. Right? Just kidding.
I think it's probably good to relax with Netflix too at times, especially when you feel like you're stressed out. But yeah, I think you just have to be mentally very active. There's also this new term called neuroplasticity. I'm very fascinated with that.
Where you like reprogram your brain, right?
You're just forming this new neuronal connections by learning new things. So whether it's learning an instrument or learning a new language or trying a different type of exercise or doing things that you typically don't do. That's really important for my brain. So I have to say this story. I had a 91-year-old patient in my office. And of course, before she even came in, my office is like, wow, she's 91. She may not be in good health condition. And all we all have this preconceived notion. And I was like, no, let's wait and see, how she is. So she lives by herself. She does Sudoku. She does word puzzles. She does painting. She helps the 80-year-olds. She actually gets these puzzles and drops them off at their place. She still drives. She's extremely, extremely active mentally. And I think that's her secret of being so great physically. So going back to what you said about your mind, it's so powerful and we have to keep it active. We have to learn new things for all these neural formations, and that does help with chemo brain.
Yeah, those are great tips. I think so many people out there suffer from that mental fog.
Yes.
We need some help.
Yes,
for sure. So that's definitely helpful. So thank you.
Let's talk about neuropathy. So neuropathy is this tingling in your fingers and toes. And I just had a patient today. She's pretty bad neuropathy from chemotherapy.
How far out was she from chemo?
She's actually more than a year out.
Okay.
And so it can happen, but also you want to make sure you don't have diabetes because diabetes can cause peripheral neuropathy. And if you have that in combination with chemo, that can make it worse. Diabetes can cause the peripheral neuropathy, sometimes kidney failure, people who have alcoholism and kidney problems, things like that can cause neuropathy. So my point to that is you have to figure out, is the neuropathy coming from cancer treatment or is it something else? I think it's important to distinguish that. And my patients usually describe it as tingling and burning and weakness, and almost feels like electric shock going through your fingers and your toes. And sometimes they have trouble holding utensils. And she was describing she was having a hard time writing, and I was just,
that's frustrating because it's like cancer is one thing, but then you have all these side effects like anxiety, depression, neuropathy, chemo brain. Nobody really talks about or knows, or hot flashes, all of those things. So it's tough.
And that's why I think survivorship issues are so important for women, because they do kind of feel like they have no one to talk to, because the treatment is done. They're not seeing doctors, they're not seeing anyone. Now they have to deal with all these things on their own. It's important to know at your own institution, do you have survivorship? Can you go to a survivorship clinic where they can talk about all these things? Unfortunately, I cannot spend as much time in my office because I'm talking to the new cancer patients. So I don't have as much time to talking to cancer patients who've been diagnosed a few years before. But it's important to find ways to deal with the symptoms and don't feel like you're alone and ask for help.
And there's a lot of resources as well. Like I'm thinking the Young Survivor Coalition, not that they have to be young. And then there's the breast cancer community. I believe there's an app or a breast cancer health line or something like that. I can put a link to that as well, just to connect with other people. And
the American Cancer Society is really great. I'm actually
Oh yeah.
I'm actually doing their walk for, Strides Against Breast Cancer on October 8th. And they're a really great organization for helping women as well. And some of the ways to handle neuropathy is just to be careful with sharp objects, because you could cut yourself and not even know that you cut yourself. And make sure you're wearing well supported shoes so that you don't develop sores in your feet. Acupuncture, again, I go back to that. That's also underutilized for neuropathy, and physical therapy when you really need it. That's important. And you should talk to your doctor. And again, there's things like Neurontin, gabapentin, things like that, that the doctor can prescribe for you.
I did acupuncture because I knew that Taxol would cause neuropathy.
Yes, Taxol is very well known.
Yes, so I did acupuncture during my treatment and even before I started my Taxol. And then I did the ice packs on my hands during chemo as well.
Yeah.
I had minimal neuropathy.
Good.
And I did like hand stretches. Like I was doing all kinds of stuff because I was just worried because one of my friends had the neuropathy and she had to do physical therapy because she was tripping over her feet. And it was just like, oh, it broke my heart. But there's definitely some things out there to take advantage of to help reduce that.
Yes. One other topic I do want to talk about is fatigue. I do hear that a lot from patients, whether it's after surgery or after chemotherapy, after radiation. And nearly all patients will have fatigue through their journey after surgery, chemo, radiation, but it's not going to last forever. But you should expect it initially. And that's why when women say, I want to go back to work the next day, I'm like, no, you have to take time to get better, get healed from this surgery. You also have to make sure that you don't have any other medical problems like thyroid problems and anemia, sleep problems, or you're getting enough sleep. So you do want to talk about those things. So some of the ways to deal with fatigue. You really have to be very purposeful on what activities you're spending time on. So it's not like before cancer, you could do a million things and, do fine. But now you just have to be purposeful and just do few things a day, but take breaks during the day. Whether it's taking a 10-15 minute nap, it's okay. Your body just needs that kind of a break. And even if you're doing, like sometimes I see people have all these activities with kids, taking them to soccer game and football game and basketball game, and they're just running around constantly, delegating that to another family member, and maybe not doing everything all in one day. Massage is really great for fatigue. Sleep, of course.
Did you guys hear that? Massages? Take care of yourself.
Yeah, and sleep is really, really very important. So that's a different topic. We'll come back to that at a different time. But sleeping is very important, and it's associated with depression, anxiety, fear of recurrence, and fatigue, and fogginess in the brain. I mean, so many different things. Sleep is a big thing.
And I think too, like allow yourself to be okay with that and not to feel guilty. Like that's coming a lot from us and our own guilt we feel as a mom or a partner, having a partner or whatever it may be, but it's okay. It's okay to take time for yourself and to rest. And that's another thing I think I've changed a lot after cancer. Like I will lay down. I will lay down at 7 and be done for the night. Like, and my family knows it, and that's as good as I can do sometimes. But it's definitely worth it. Your body needs it.
It's also important to what you're eating. It's important making sure you're not eating lots of high sugar foods because that can drain your energy, making sure eating a lot of fiber, eating protein, drinking lots of fluids, and not drinking too many sugary beverages. So that's important too. So.
Well, we hope this is helpful for everyone, and just talking about survivorship and things that we go through, and knowing that this is part of it, but you're not alone in this. And we hope that some of these tips and just being able to talk about it provides some comfort.
Yeah. I hope this episode helps you guys, and you guys can contact us if there's any other topics you want to hear about. And just know that we are all going through it. We're all in the same boat, although we have different journeys and different side effects and different issues we are dealing with. But know that there is always someone you can call on to help.
Absolutely. Thank you. So until next time.
Bye.
Thank you. Bye.